Good morning and welcome to A Soft Pause. We're here again for our second installment of Dishing with Dr. Delaney. And today we are going to talk about the good, the bad, and the ugly. The good being Dr. Delaney and the foster owners that are trying to take care of their animals the best that they can. The bad and the ugly are the parasites and the worms that can infect them, and often they come infected and ill with those things up from the south. So we're going to start by going through just those common issues that we can have and what they are, how to treat them, and the side effects that they may have. So I'm going to turn it over to Dr. Delaney now, and I think we're going to talk about worms first. I'll write it up here on the board as we go along, and we'll be showing you pictures of what all of those lovelies look like as well. So if you're squeamish, close your eyes. Anyway, go ahead, Dr. Delaney.
Thanks, Debbie. So basically it breaks down to two different types of parasites that we treat. There's the internal parasites and the external parasites. The internals are the worms that we tend to think of. So your roundworms, whipworms, tapeworms, and hookworms are the big four that we'll usually see. We also have something called protozoan parasites, which are your giardias and your coccidias. So we'll start off with the easy ones. Roundworms are pretty easy to get rid of, and they're pretty easy to understand. So as far as how your dog or cat gets roundworms, if it's an adult dog or cat, they'll usually get it by eating gross things in your environment. So poop is the main one, specifically of wild animals or other infected dogs and cats. But if it's younger, like less than 5 to 6 months old, those ones are typically infected through a transmammary route. So these worms can transmit from mother to baby through their milk or through the uterus and placenta. So sometimes they can be born infected with worms. It doesn't change any of the treatment plans. It doesn't change anything about the animal's quality of life. All it means is, based on their age, it tells us how they were infected. So if you have a baby that's infected with roundworms, odds are good that your mother is also infected. You should treat her too. So the way that we do treat them, most of the worms that we're going to talk about today most of the parasites in general that we're talking about today are treatable with what veterinarians call monthly preventatives. We do have specific medications available, your Albans, your Panicures, your things like that, but praziquantel. But we usually will just treat them by starting them on a monthly preventative. So your NexGard combo for kitties, your NexGard Plus for doggies, Simparica Trio is another one for dogs. We have a lot of options, and they all, depending on which one you choose, will treat the parasite in question. Depending on how high the worm burden is, which basically means the number of worms that we find in a sample, it might take multiple treatments to cure them. And by that I mean, instead of it taking 1 month to treat and cure the parasites, it might take 2 if there's a lot of them inside the animal. The way that we test for these is with a fecal sample. So you bring a poop sample to your vet and they'll send it to a lab. The lab tells us how many worms and which types of worms are in there, and then we write out a plan and talk with the owners and clients about how to treat it next and make our recommendations.
So if you have an animal that you bring in with roundworms, will they generally do an immediate treatment with something else, or if we start immediately on that monthly plan, will that take care of it?
So you're asking if we already know if they have roundworms?
If I bring Ani in, let's just pretend that Ani has roundworms, and I bring him in and it shows roundworms in his fecals. Do you treat him with a medication and then start him on preventatives? Or if I have one in a group of puppies that has roundworm that are 6 months old? Can I treat all of them with a monthly treatment and that eventually take care of that? You know what I'm saying?
Yes. So the monthly prevention is also our treatment.
Okay.
So if we have a new diagnosis of roundworms, typically what we'll do is we'll start them on the preventative of that veterinarian's choice. These are all prescription-based medications, at least the ones that work the best. Even the ones that treat the worms but are not preventatives are still prescription-based. So either way, you're going to need to work with a veterinarian, whether it's at the shelter or your own personal veterinarian, to get these medications and get a treatment plan together. You can't do this at home. And I would never recommend it either.
So if you have, what are the signs? What are the signs and symptoms of an animal with roundworms?
A lot of the time, nothing. So sometimes with puppies, you'll see that wormy belly, which is like a really cute puppy with just a really pendulous round belly that when you squish it, it feels like Play-Doh almost. That can be a sign of roundworms. It's fairly reliable for an experienced veterinarian or individual to have seen all of these, kind of know what it looks like.
So that looks different from the roly-poly puppy look.
Yes,
The
there's a
worm
difference.
belly.
Yes, there's a difference between a roly-poly puppy and a wormy puppy. Wormy puppies are typically more distended. They'll typically, since the worms are taking the puppy's nutrition from them, typically what's going on is, at least the way that I would describe it, is if you just look at the bones of the puppy, like the top line of the puppy, you can actually kind of see more of their ribs and of their spine than you would like to. Typically, they're a little bit more on the thinner side with a wormy belly, if that makes sense. Like they have a nice round belly, but it's not continuing up to their back line.
It's not caused by great nutrition. It's
Exactly.
caused by an issue.
Over nutrition.
Right, and we see a lot of those coming in from the south. They look like these, just from the inexperienced eye, they look like, well, they've been taken really great care of because they've got these nice big bellies and, you know, geez, they look like they're doing okay. And then we find out they really aren't okay. And once you get rid of that wormy belly, now you have a skinny puppy because the distension, correct me if I'm wrong at any point, but the distension goes down once we start getting rid of that load of parasites. And now you see this puppy that's actually undernourished because of what was happening with the parasite and possibly what was happening with them at their point of origin. So when you get a new animal in, I think it's gonna be a theme that if you get a new puppy in and it has not had its veterinary visits, make sure that you get them to the vet with a fecal sample so that we can see what's going on. One of the things, like we just talked about, the 3 days, 3 weeks, 3 months. If you can go ahead and give them that 3 day of decompression before you start introducing a vet to them also, you can just take a fecal sample into the vet that they're going to see and see if they will run it. Some vets won't until they have a visit with the puppy also. Just to clarify, the rule of threes that we talked about on the last segment is the rule of threes when it comes to adopting an animal and how to adjust to their needs. Delaney has brought up that there's also a rule of threes in veterinary care. So we're talking about two different things. So in the rule of threes, we talked about giving those 3 days to just decompress in your home. And then on that 4th day going forward in that 3 weeks, get them to your local vet so that they get a nice checkup. And so we're talking about two different things here. Not a rule of threes on treatment for worms, just the rule of threes on give them a couple of days to settle into your house, then get them to the vet. And if you can, if your vet will allow it, get a fecal sample done on the animal as soon as possible so you know what you're dealing with. And don't expose them to the other animals in your home or the feces. Don't let your dogs in the home be exposed to the feces of that new animal either until you get that treatment going so that we make sure we aren't cross-contaminating. All right, continue.
So roundworms are not deadly. It takes a lot of worms in general to cause the kind of problems where their life is threatened. So, as we mentioned, those 3 days are most likely not going to be a detriment to your animal's health, but you need to bear in mind that if you have a wormy dog, you're going to have wormy poop, and you're going to have that risk of cross-contamination. So, agree, it's always good to isolate new puppies and kittens before introducing them to the other animals, both for their mental and emotional health and for the physical health of everyone involved.
And can you see the whole worm? Can you see the worm in the poop? With
Not
the
always.
visible eye?
Not
Okay.
always, not usually. That would be a lot of worms.
Okay.
Um,
Do you see it after treatment in the poop?
you can.
Okay.
We typically will warn owners or clients that once we treat, these worms are going to die, and the way that they die is by coming out in the feces. So, yes, you can see the worms coming out after we've treated them, but you don't usually see them before treatment because they like to stay in the body where that's where their environment is, and you're not going to see roundworm eggs with your naked eye.
Okay.
So that's pretty much roundworms. They're not going to kill the animal, at least not in the early stages, and they're very treatable. They're really easy to treat. You just do monthly prevention, and most veterinarians will do a recheck fecal to make sure that they're clear, and then you'll talk about integrating your new pet to the household.
And they are one that causes that wormy distension of a belly.
Typically, yeah.
Okay. Alrighty. Next.
The next ones that we see are tapeworms and hookworms.
Same thing?
They're not the same thing.
Okay.
They are the same shape.
Okay.
So there's a lot of subgroups of parasites. Roundworms are your true worms. We call them nematodes. Tapeworms and hookworms are not worm shaped. They look a little bit like pieces of toilet paper.
Or rice.
They're flat.
Little white
So
rice.
yes, so what you see, this is what the rice grains are in dog poop, is the tapeworms. And it's, the medical word for that is a proglottid. It's basically, these worms don't reproduce by producing eggs. They will physically detach parts of their body and release those, and those are what develop into multiple different worms, and it's a proglottid, and those are the rice grains that you'll see. So tapeworms and hookworms are both a little bit flatter shaped. You don't usually see hookworms in the stool, but you can see the tapeworm rice pieces.
So I'm just writing breaking off in stool.
Yep.
And we're
Yep.
going to just write rice.
Yep, those are the ricey boys. These ones are also
Not
pretty
real
easy.
rice. They look like rice. Don't eat it.
Don't eat it. These are also pretty easy to treat. Same thing, we can treat them with individual, like, targeted medications like your albans and your panicures and stuff, and your Drontols and stuff like that. But they also work with preventatives. Every heartworm prevention that we have is, almost all of them are also used to treat roundworms and hookworms and tapeworms. We don't use them to treat heartworms, we can use them to treat these intestinal parasites because it's the same medication, just in a different shape.
Okay.
So these ones are also pretty straightforward. You'll send in a fecal. If they're present in the stool, we'll tell the client, and we'll recommend our treatment plan based on that veterinarian's preference and what they have in stock. They are a lot like roundworms and how they affect the animal. So tapeworms, the main difference is how the animal gets infected with them. So tapeworms is passed on by fleas. So cats and dogs will get it by eating the fleas themselves, either by cats hunting rodents that are infested with fleas and eating those, or grooming themselves and eating the fleas off of them. Dogs can also get them by eating wildlife and stuff like that. So the main way that we prevent infections of tapeworms is by preventing fleas, because it's the main vector that we have to get them to our animals. So if we can eliminate fleas, then you don't have to worry about tapeworms at all.
And are they passed from mother to puppy?
Tapeworms are not.
Okay. So generally what's happening, if you're seeing a whole litter with a mother that has tapeworms, they've all been infected by the flea externally.
Yes.
Okay.
Yes.
Alrighty.
If you see tapeworms, that means that somebody has fleas at some point.
Okay. Great.
Yeah, it's
Or
gross.
has eaten poop with fleas.
They have to have eaten the flea. It's unlikely to eat poop with a flea on it because that's not what fleas eat.
Okay.
So somebody around them had to have had fleas, most likely. Hookworms are a little different. Those can be transmitted transmammary to babies. That's the main way that young animals can get infected.
Oh, I already had a cup. Hook or crook?
So this is similar to roundworms in that young animals are usually infected early on by drinking their mother's milk, whereas roundworms are mostly transuterine or transplacental, so they're born with roundworms. Hookworms are more through the milk consumption. Adult animals affected with hookworms most likely got them from eating poop and wild animals.
Okay. Oh, those poop eaters.
Yep, they're always fun. Always fun.
Always fun.
The other main thing to note is that hookworms are zoonotic, which is a fancy doctor word for they can affect people as well. So with all parasites, we always recommend cleaning up feces, cleaning the house, bathing the animals, but you want to be extra careful with hookworms because they are transmittable to people. The main way that people get them, and this is going to be really gross, so skip ahead if you don't want to know, but if you're like walking barefoot in your yard and you step where your dog pooped or something, except near it, not even in it, they usually, those are the horror stories you hear, like hookworms in your feet. So they go through, it's cutaneous is what we call it, so they go through your skin. Transmitted orally if you're like not cleaning your hands or something.
And we listed hook and tape on the same segment, so are hooks breaking off to reproduce as well versus egg? Are there segment of hookworm like you see in tapeworm?
We don't usually, you're not going to see them with your naked eye.
Okay.
Not usually for hookworms. Usually that's tapeworms.
Okay.
They're I grouped them together because basically they're not true worms.
Okay.
So they don't look like worms. If you see a worm, it's not tapes or hooks.
Okay.
Is basically the main takeaway to have there.
Okay. Where's the roundworms? Not to sound gross. Watch this after you eat, not before. Look like spaghetti.
Yes.
Yeah. Okay. Alrighty. So we've got rounds, tapes, and hooks. Next.
There's one other worm, and this one is a true worm. I saved it for last because it's the hardest to get rid of, and you'll probably never be rid of it truly. So this is whipworms. Whipworms are incredibly stable in the environment. Their eggs are super good at surviving in harsh situations. They're really easy to reinfect the animal with. So if your veterinarian tells you that your pet has whipworms, it's a little bit more involved. You can treat with prevention, but since they're so sturdy and resistant to a lot of the stressors we throw their way, these are the ones that typically veterinarians will recommend a specific anti-parasitic agent. Usually it's something like fenbendazole, like a Panicure kind of thing. So these are the ones we typically hit with a little bit of a more concentrated dose of an anti-parasitic agent. You have to get it from a veterinarian. You cannot get it over the counter. I do not recommend getting it over the counter if you find it.
That's a good one to, let's say that again. Because a lot of these things now you can find them over the counter, and some of these things you can find in Petco or Tractor Supply or something like that. So you're able to receive them, but not necessarily the dosage that you need to actually treat your animal.
Yeah. Typically, we have clients all the time. They'll come in and they will say, oh, well, I gave them, my dog is on a Seresto collar, but it's not a Seresto collar, it's a collar that looks like Seresto. We went to Tractor Supply, I love Tractor Supply. We went to this supply store and we found horse dewormer, so we just gave them a quarter of a horse dose. That's not how medications work. These are all calculated very specifically for these animals' metabolisms. A mammal is a mammal until their differences are what kills them. So you can give a dog NSAIDs, do not give them your NSAIDs. They can have canine specific NSAIDs. You cannot give a cat an NSAID, it will kill them. So there's a difference between mammals, even though they're all very similar animals. A dog is not a cat for a good reason. So
well, we can all eat chocolate. Hell, I've survived.
Yes.
Heck, I've survived on chocolate for days, and it hasn't done anything to me. But if we give the chocolate to the dog, it's going to do something pretty significant for the dog.
Exactly.
Yeah.
So if you find the large animal stuff at a supply store, it's not necessarily going to be what's best for that animal, and we have no way of guaranteeing that what you've purchased contains what the label says, especially if it's not within the scope of the FDA. So that's why most veterinarians will try to push for the products that they know. 9.5 times out of 10, it's not because they want to make more money, it's because we know what's in our products. We've vetted the suppliers, we've read the studies, we know what's in it, and therefore we know how it's going to affect your dog or cat, and if something bad happens, we know how to fix it. So that's the main reason why we're so adamant about that. But back to whipworms, now that we're off our soapbox.
Whipworms are the most hardy in the system, but from my experience, I've fostered right near 300 animals now, and I know sometimes it feels like all at once. But I think I've seen whipworms twice.
Yes, we don't see them a lot.
Which is good if
We
they're
don't
as
see them
they're
a
as
lot, which is
prevalent
good.
as they are.
Yeah.
But will they show up on a fecal?
Yes.
Okay, so if I take them in and give a fecal, you're going to see that even if it's. I was just afraid maybe they also hide from detection. So they're easy to detect.
They're easy to detect,
Difficult to
hard
treat.
to get rid of.
Okay.
Yeah, easy to find. They're actually really pretty. Their eggs are like really symmetrical, and it's actually quite satisfying.
Says the vet.
Their eggs are very distinctive. We know exactly what they look like, but they're just hard to get rid of because their eggs are really, really resilient to environmental changes. So we have to use harsher chemicals and hotter temperatures to get rid of them. So typically if I have a patient who has whipworms, what I'll usually do is I'll prescribe them some form of usually fenbendazole, which is like your panicure granules. And I'll prescribe it for the canine approved dose, and I'll send it home with the owner. This is where that 3 days, 3 weeks, 3 months comes in. So depending on your vet, every vet does it differently. We all have seen different success rates with everything. All the recommendations in the textbooks are averages. Every vet delineates from there. So typically the recommended dose is you give them X amount of medication for 3 days. And then you're going to repeat that 3 days, 3 weeks from now. And then you're going to repeat that 3 months later. So that's a 3 day, 3 week, 3 month treatment period. Sometimes we only do the 3 days, 3 weeks, and then we'll recheck a fecal. And if they're clear, we don't have to do the 3 month one. Every vet's different.
We couldn't go with 4.
It's, you know what, 3 is a nice, sturdy number. But yeah, so those ones we're typically more aggressive with. We're also more aggressive in our recommendations, or at least I tend to be, for preventatives. Every pet owner is different. I have clients who will take my word as gospel and do whatever I say. I have clients who will ask me questions and want to do research, but ultimately they'll typically defer to what I suggest. And then I have clients who don't trust and then I have clients who maintain a healthy amount of skepticism. They want to take a more holistic approach to their animals. All of these approaches to your animals are fine. You are individuals just like your animals are individuals.
Well, I think cost falls in there too.
Yeah, cost is definitely a big thing. I'm not going to pretend that veterinary medicine is cheap. It's the same stuff as human medicine with no insurance. That's why it's so expensive.
Well, I
Honestly,
think
it's cheaper than fecal medicine is if you were to do it out of pocket.
what I've heard a lot, because a lot of the animals that we get through rescue come from the South. Heartworm is big in the South. It's a big issue. It's a big killer in the South. So a lot of times those medications are heartworm preventatives and all this other stuff. And I think what I hear the most is, oh, I don't give them the heartworm medication because heartworm isn't as big of an issue here in the North. Yes, in the South, not here in the North, but what we're not, excuse me, what we're not reading, or I don't have ticks because my dog doesn't go out in the yard where there's ticks.
Oh, don't worry, we'll get to that for the extra
right. So I don't have to treat with that preventative, but the small print is that preventative also takes care of all of these other things too. And I think that's, I hear that a lot. Oh, well, we don't have heartworm up here, so I don't do that.
It's a bit of a misnomer to call it heartworm prevention. We should call it parasite prevention. But we're all set in our ways. We're crotchety old veterinarians over here.
Yeah, you especially. Crotchety and old.
But to be fair to owners, the onus is on the veterinarian to explain what's in the products. And if the client leaves thinking that they refused a heartworm product and their vet recommended heartworm treatment for their roundworm dog, that's on the veterinarian for not being clear enough and concise enough. Not to say that they're a bad doctor, they just didn't have a clear enough conversation that day.
Or they expected that, I mean, to be honest with you, Delaney, I think this is probably not the first I'm hearing of it. That's an insult. But I'm learning that the round and the tapes are treated by that for the first time today.
Yeah.
Because in rescue, we bring them up and we dump the Albon or the Panicure or the whatever in them, and we aren't treating our rescue animals. In some rescues, they aren't treated with a monthly preventative because we're expecting they'll be adopted out, and that starts there. And so I didn't know that either. And I have a phenomenal vet. So
it's
I think
not me.
It's not her. She trained under them though, or she did some work under them. But I think a lot of times the vet expects, for someone like myself who's fostered as many animals as I have, that I know that. And so they don't have to explain that as much either. So, we're saying it here, and that's why I'm doing these segments, is just for those of us that are out here doing this to be able to get some information that maybe we didn't know before. All right, what's next?
We'll finish up the PSA and we'll finish up whipworms. Never be afraid to ask questions. A veterinarian who doesn't want to answer questions from their clients shouldn't be in the field, and I feel comfortable saying that because I know that all veterinarians that I've talked to believe that. So ask us your questions. Yeah, or doctors. Ask your doctors questions. Ask your vet questions. Ask them, why are you giving me heartworm prevention for my roundworm dog? It's okay to ask these questions. It's okay to not know. We understand that we went to school to understand this and to be able to tell you about it and explain how it works. Be kind to your younger veterinarians. They're still mastering that conversation and how it best should flow and how to adapt to different clientele. But ultimately, if you don't ask the question, there's no way for us to know you didn't understand. And if we don't give you all the information, then there's no way that we should be able to expect you to know what's coming next. So it's a transaction, and it's a partnership between client and veterinarian to get all the information together. So ask your questions. That's how we know what information you need.
So question for you on that. If I have a dog, I think I know the answer, but I want to make sure. Personal experience. Ani is throwing tapeworms. So we know that he has tapeworms. We had, as you know if you followed this channel, we had a litter of cats infested with fleas. Infested. And so as careful as I was, I could very possibly have missed a few of the fleas and he gotten them. At the same point, Ani came into me with the tapeworms. So my question is, he's on a monthly preventative. So if the load is bad enough, we're taking several cycles of, I've only had him for 2 months. So we haven't gotten enough of those
Yes.
cycles in to
Yes.
get all of those worms.
It's a very
Okay.
good question. It can take multiple cycles depending on how high the burden is. So the lab usually classifies it for us as many, multiple, and few, or like some delineation thereof. So it's basically based on how many you can see on a microscope without moving the slide. And so if there's a lot of worms, you're almost guaranteed to need to do multiple treatments. And it doesn't change the treatment plan. If we retest the fecal, that's why we retest, is that we can make sure that what we're doing is working. I have a patient at work this week that had a heavy, I think it was actually tapeworms, had a heavy tapeworm load. We treated with prevention, did a recheck fecal, and it still had tapeworms, but instead of having many, it was rare. So I was like, oh, it worked, now we just need to finish.
Okay.
So we just continue the treatments. And also, the goal of starting these preventions, and the goal of using, part of the goal of using the preventions other than to treat the animal, is to continue the preventative. Because if you're giving, the way these preventatives work is they kill what's there. They don't prevent the future generations.
So they're not technically preventatives.
They're heartworm preventatives and internal parasite treatments. So heartworm prevention, which is usually an ivermectin of some sort, does prevent future generations. It doesn't do much to treat what's already there.
Okay.
If you're treating internal parasites, it's the opposite. So if you have worms and you give the prevention, it kills what's there. But after that dose is given, if you give the dose on Tuesday and it kills everything that's there, but your dog eats something on Thursday, those are not going to die, most likely. That's an exaggeration. I'd like to think that maybe a day or two would be safe, but like if they eat them the next week, those are not prevented. And those won't die. So that's why we recommend continuing the treatments. It's why we recommend keeping your yards clean, because there's only so much you can control. You can control how clean your yard is. You can for poop purposes. You can control what you're giving your animal. You cannot control how many wildlife walk through your yard. No matter how many treatments you do, you cannot control how many mice and rats and squirrels and chipmunks and even possums and raccoons come into your yard. No matter how good your fence is, no matter how tall it is, no matter whether
How electric it is.
How electric, no matter how far away the trees are. You cannot control the wild animal population. They will come into your yard. And you can't control what your dog eats in that yard, even if they're on a leash. I've had apartment living and I've had house living, and I had to walk my dogs every day when I lived in an apartment, and they still ate dumb things because they're low to the ground and they see it before I do. You can't guarantee that you're going to be 100% all the time. And so the best way to prevent them from getting sick is to prevent it. In the case of worms, the prevention is the same as the treatment, so it's not as much of an economic thing necessarily, so much as heartworm is very economic. That deserves its own video. And Lyme disease, which we'll get to later, is very economic for prevention.
So, so far I asked directly on the roundworm, and we talked about the distended belly. Tapeworm, hookworm, whipworm, do we see symptoms?
Not usually.
Okay.
For most of these, you may or may not see symptoms. At most, you'll see a little bit of diarrhea, or sometimes they'll have some trouble pooping, or like they'll be straining to go to the bathroom sometimes. With whipworms, you might see some blood in the stool, but intestinal parasites are pretty incognito.
What about that dragging the butt across the carpet?
That can be a sign of irritation from parasites. My instinct and my personal experience has been that that's usually for higher burdens. And most of the time, if a dog is scooting, it's usually not from parasites. There's usually some sort of like allergy or direct irritation component coming, so it can be a little bit
Or a St. Glen
confusing.
issue.
Yeah, it could be from something else that's also going on. You can't necessarily tie it directly to parasites, although it could.
Okay. Great.
The way we treat whipworms, we already talked about treating whipworms. The way we get them out of your environment is with ammonia-based killers. Please do not mix bleach with your ammonia cleaners. And really hot water, like boiling water, is how we get it out of the environment. They're very hardy.
And can they transfer to humans? I've
No.
never heard humans having whipworms.
No, they cannot.
Okay.
But they're really easy to reinfect. So if the dog gets treated and then it leaves in their poop, and then you might have missed something when you cleaned and the dog gets reinfected, you're at the same cycle of treatment. Whipworms are one of the few parasites that I'll push a little harder for monthly preventatives, and it's a specific pairing of prevention that is FDA approved for prevention and treatment of whipworms specifically. And usually we'll keep those dogs on it for life, and if they get a second dog, we will put that dog on the same protocol because they are so hardy and so persistent in the environment.
Do we see them in cats?
This is more of a dog thing.
Okay. It's a dog thing.
It's more of a dog thing.
Okay.
I've never seen them in cats.
Do we cover our worms?
Yeah, that's pretty
Alrighty.
much it for intestinal worms. There's the protozoas are your Giardia and your Coccidia. So Coccidia is more of a cat thing, but you can see it in dogs. And Giardia affects both, but I do tend to see it more in dogs.
Okay, so protozoa. You talk all right.
So a protozoa is basically a life form.
Did I misspell it?
Yes.
How's it spelled?
Protozoa.
Oh.
Okay,
Okay, this is an A, not a U.
okay.
Okay.
I was like,
Guess
I don't
you were
think
like,
I said protozoa. So a protozoa is basically a life form that doesn't qualify as a bacteria or a fungus. It's one of those weird in-betweens. We don't care. We don't need to know about that right now. But it's a thing.
Life form.
Yeah, it's a thing. It's a little alien. So
That's what I think when I get it. The darn aliens are back. Not I get it. I've never gotten it. But I have a lot of dogs and cats come through with it.
Yeah, so these ones are a little different, just because they're different types of organisms. We treat them in different ways. So Coccidia has a couple different names. It's also used to be called Cystoisospora.
Not spelling that one.
Yeah. So if you hear a
Coccidia.
veterinarian refer to it as Cystoisospora, something like that, they're talking about Coccidia.
C-Y-S.
T-O.
Cysto.
Yeah, cysto, blah, blah, blah.
Yeah. Cysto. Okay.
This one is typically in cats, can be in dogs. This is what we treat. We'll treat this with Albin. It's just a one oral treatment, and we might do a couple over the course of a few days, depending. It's pretty easy to treat. Protozoa tend to be a little hardier in the environment, so we're going to want to make sure we clean up feces, and if you have a cat with this, wash your hands and everything like that. This one is zoonotic. It's gross. It will give you the poops, and it won't be fun. So wash your hands, kids. This one typically causes diarrhea. You usually will see signs with Coccidia and Giardia, but you don't necessarily. There's a lot of reasons a dog or a cat can have diarrhea, so you can't necessarily see loose stools and be parasites. There's a lot of things that could happen.
For those of you that follow my channel, Cheyenne, the cat that had her litter of kittens and has been to the emergency room a few times, and was touch or go there for a while. She had coccidia, she had roundworms, and she was infected with fleas. So
Probably had
probably had tapeworms as well. So she had fleas. She had an infestation of fleas. Coccidia, fleas, and roundworms. So and was trying to nurse 7 kittens. So that's a major load. And we had the problem that we couldn't treat the kittens, and we're only able to treat the mother. That's why Laramie did so much better, because Laramie had 3 weeks of being able to be treated before she gave birth to her kittens. So just as to work this all back into something that you've seen on the channel.
Yeah. If you have kittens that are infected with anything or have been exposed to any of these parasites, it's definitely best to work closely with your veterinarian, because certain medications are indicated for different life stages. So we have some of them that are only for 8 weeks and above, and then there's a few that we can give to young kittens. Albin is one of them. We can give them as young as 2 weeks old. You're kind of out of luck if you have newborns, just because
Which is where Cheyenne was. Yep.
Yeah. So you kind of have to wait a bit. So definitely have to work closely with your veterinarian if you're trying to keep a litter of kittens healthy while they have a parasitic burden.
So with coccidia, we're going to see diarrhea.
Usually.
Okay.
Same with Giardia.
Okay.
Oh, Billy.
Okay.
Giardia. Giardia is another protozoan parasite. It also can cause diarrhea. You can see bloody diarrhea, but you'll very often see nothing, which is very fun. It's pretty easy to treat. We have 2 different ways that we'll do it, depending on your veterinarian and their preferences. They'll pick one and give it to you. It's typically a 3 to 5 day course of whatever medication they give, and then you'll recheck the fecal a few days after that. So within a week, you'll do 2 fecals usually. Giardia is a protozoa. They get it by eating stupid and gross things in the environment. It's not usually transmitted mom to baby the same way that the worms were. It's pretty straightforward. A lot of dogs get it. Like a lot.
Can you see it?
No. No. Protozoa are microscopic organisms. You're not going to see any of these in the stool. You're not going to see any of these in the environment. They have a very distinctive look on a microscope, but
Correct me if I'm wrong, Delaney, and I could be wrong. So it's good we're at the end of this, so I can cut it off. We've had Giardia, not me personally, but Bogey had Giardia.
Right.
We could not get rid of Giardia, and I was told it was because it's in the ground.
Yeah.
So tell me a little bit about, if you do get Giardia, what are some of the, outside of treating the host or the dog, what else can we do to try and get rid of Giardia?
It's really hard to get rid of in grass. You can throw boiling water on your lawn. That's always a fun idea. This is another ammonia responsive treatment. So ammonia will kill your grass, but you could spray your yard with ammonia. But boiling water, ammonia, trying to prevent your dogs from eating poop, keeping your yard clean, bathing the infected dogs, so specifically their hind ends. Once you find out that they have Giardia, give them a bath, and then at the very least do it again at the end of their treatment cycle, so 3 to 5 days later. If you are committed and the dog is good enough, do it every day. It's not going to hurt them, it's only going to help, but at the very bare minimum, I would recommend right when you start and then right when they finish the treatment to clean their back ends. It's annoying. Protozoa are sticky. They stick to grass, they stick to the environment, they'll stick to whatever surfaces in your house.
And I think, correct me if I'm wrong, the Giardia is long living in an environment too. It's not, roundworm, you can get rid of roundworm fairly quickly if it doesn't have the host to eat off of too. But Giardia can just go on forever.
The thing about protozoa is that they have a life stage that's called cyst, basically. It's kind of like when a fungus has a spore. And if you're familiar with the flea life cycle, they have a pupa form. They're all very similar. They serve similar functions within these life cycles, which is to basically hunker down and hibernate until the conditions are right. They are incredibly resilient, very tough to get rid of, because as much as you want to damage that external cystic barrier, and when I say cyst, it's not like a fluid pocket. Those are 2 different kinds of cysts that I'm talking about. it's like an encysted structure, and it's kind of when it just creates a shell around itself, and it's the most protected form of that parasite.
Where do they come from? Do we know? Aliens drop them in the middle of the night?
Basically.
So it's not a mosquito born?
No, it's not. The vectors are going to be your wild animals and other dogs.
Okay.
So it's another thing, like, unfortunately we don't have preventatives for Giardia. We do have treatments. And once it's in your yard, it's hard to get rid of, but what the best we can do is clean the poop, clean your house really well. If you find out that your animal is infected with Giardia, it's not unreasonable to isolate that animal in a different part of the house that's easy to clean, like a bathroom. I don't recommend doing it in the kitchen.
For obvious reasons.
Giardia is not zoonotic, so you don't need to worry about your kids or your own safety. I would still wash your hands and keep everything clean, just for the mental sanity of knowing that your house is clean, at least. But you don't have to worry about getting sick from managing these animals with Giardia. What you have to worry about is your other animals or that animal getting sick again. So it can be hard to get rid of.
Okay. All right, so now we are going to switch from the internal parasites and talk about the external parasites.
So, as you can tell by the board, we're going to do 4 main groups with a few subcategories. So we'll talk tick diseases, fleas, ear mites, and then ringworm, which is not technically a parasite, it's a fungus, but it kind of fits in here.
It has worm in the name.
Yeah. So, ticks, the biggest thing, ticks is the biggest thing to start with. So we'll start at the top with Lyme disease, which in our area of the country, which is the Northeast, is a big, ubiquitous disease. Pretty much everybody with a pulse gets it. So we'll talk Lyme disease, about how you get it, how you treat it, and how we monitor it moving forward. And then Anaplasma and Ehrlichia are less prevalent, and are treated somewhat similarly, but we still see them here, so we'll talk about them a little bit. Lyme disease is a bacterial disease transmitted by ticks. All of these are. I'm sure we've all heard of it. It's not transmissible from dog to person, but everybody can still get it as long as you're bitten by a tick. So the way that the dogs get it is by being bitten by a tick. They have to be bitten actively for a day or two, and then they won't start testing positive for a couple weeks after that. So it is a little bit of a process. It's not like you find a dog on your tick today, you run it in for a test to see if it has Lyme. That's not how it works. You're going to have to wait a little while before they even could potentially come up positive based on how this life cycle works. As far as what Lyme looks like, sometimes we see no clinical signs at all. A lot of these things have that characteristic where you might see something, you might not. It's annoying, but it's true. If your animal does show clinical signs, typically what we'll see is what we call shifting leg lameness, which basically means that they're sore all over, and they might be sore on the right front one day, and then the next day they'll be sore in the back end, and it just kind of shifts to every different joint. You might see joint swelling if it's bad enough, and they'll typically be tired, and they'll typically have a fever. So if a dog comes into us, hey, my dog's been limping on and off for the past few days, or limping at all, and we just want to know why, we'll run a temperature. Because typically when owners come in, they think that their dog broke something or pulled something. We're thinking, okay, we need to rule out Lyme disease, and then we can go for orthopedic causes.
Just to interrupt for 1 second, can cats get Lyme disease too?
We don't test for that in cats.
And you don't see adverse reactions that could then be Lyme?
We don't have a test for Lyme disease in cats. And we see it very rarely.
Okay.
I'm not going to say that they can't get it, but we very rarely see it. Whether that's because we can't test for it or not, I don't know. But Lyme disease is almost entirely dogs in general practice.
Okay.
So you take your dog in, we run a test. Most veterinarians run an annual heartworm, flea, and tick test. So the 3 tick diseases on here are on that test. That's why we're going to talk about them. The reason we run them annually is so that we can make sure that they're not getting sick with anything. We can renew the preventatives. That's the idea. But the test flags those diseases. It tells us if they're positive, and then we can treat it. So the way that we would treat Lyme normally, or the steps we take, is if we get a positive on that first blood test, it's a antibody snap test basically. It's just you put the blood in, you clip and close, and it tells you yes, there is exposure. So what it doesn't tell us is how bad the exposure is. So usually what we'll do, some vets might do this a little differently, but what my clinic does is we'll get the positive result. If it's a new positive, we'll run what's called a C6. And it's basically shorthand, I don't actually know, it's basically shorthand for the protein that they're looking for in the test. And that tells us if the infection is active or not. So we have a certain threshold that we monitor, and if that level of C6 is above the threshold, we know that it's active and we want to treat it. If it's below that threshold, it kind of becomes a should we not situation. If they're asymptomatic, otherwise healthy, and they just have a positive Lyme result with a low C6, we'll usually just leave it and we won't treat unless the owner wants us to. If we have a high C6, that indicates treatment. We'll also run a urinalysis and what's called a UPC, which is a urine protein creatinine ratio. All that really is it tells us if there's protein in the urine, is that protein because the kidneys are affected. Lyme disease has 4 main targets that it goes to in our bodies. 2 of them are more prevalent by far than the others. The main one that we all know is joints. That's what makes us feel achy and what makes the dogs limp when they have Lyme disease. The other target that is most common is the kidneys. So we'll run the urine UPC to show us if the Lyme disease is affecting their kidneys. If it is, then we can have other things we need to look out for. It doesn't usually mean much for the treatment, but it's definitely something we need to look out for, because if your kidneys are sick, that can be a major problem if you don't intervene quick enough. And to a certain extent, if you catch it early enough, you can recover the kidneys to a point where they're not negatively impacting the health of the animal. Depends on the situation. So those are the main 2 tissues that the bacteria goes to. The other 2 are the heart and your central nervous system. We don't see as many problems with that, but we can in some rare cases, so we always keep it on our list.
So is Lyme disease treatable?
Yep.
Curable?
Yes and no. Yes, Lyme disease has a treatment. We use doxycycline. It's an antibiotic. It works really, really well for any blood-borne pathogen, which is what Lyme disease is. The ticks bite us, and the bacteria gets in our blood, and it goes everywhere it needs to go. So we use doxycycline. It's usually a month-long treatment of this medication. It can be very harsh on a dog's digestive system sometimes. Lyme disease, we don't really mess around with Lyme disease. We want to hit it and hit it hard. So we do 1 month at a fairly high dose of the antibiotic, and hopefully the dog tolerates it well enough. And if they don't, we have some flexibility, but usually we'll try to see how much they can tolerate for that month without having to drop it down. So that's the treatment for it. And then what we'll do typically is, it's not usually a treat it and it goes away. It's more of a treat it and it's gonna go down to where it's not affecting the dog as much.
Okay.
So when we run an annual, we call it a 40X, a 4-way diagnostic. When we run those tests that showed us, that initial blood test that showed us the dog had Lyme disease, they're very likely to come up positive multiple years in the future. That does not mean that they need to be treated every year. What it means is the disease just becomes latent. And basically, what the test is testing for is antibodies. So all it means is that there was exposure. And if we know that the dog was treated in the past, of course it's going to have exposure, of course it'll test positive. That does not mean that those antibodies are active. We'll only treat again if they start to show signs of being sick with Lyme disease.
You may not know the answer to this, but is it generally they've been latent for a while, and for stress or whatever has brought that back up again, or do you have another exposure of Lyme?
It can be either.
Okay.
They can come out of the disease can come out of latency and spike up again, or they, that's pretty much Lyme.
Okay.
How to prevent it, how to treat it. It can be somewhat cured, depending on how you look at the word cure, but that's not really our goal. Our goal is to just prevent clinical signs and prevent them from being uncomfortable and make sure we're protecting their kidneys.
Okay.
So that's Lyme disease. Anaplasma and Ehrlichia are a little bit easier. Anaplasma is the second most common one that I've seen. It targets a slightly different part of the body. It targets the platelets, and it can also target the liver.
Okay.
Yeah. So it can target the platelets, and it can also target the liver. Mostly platelets, though. Platelets are red blood cells, or fragments of red blood cells that are responsible for clotting. So the reason we're worried if we see a new anaplasma positive dog, again, this is a disease of dogs, what we'll do is I'll call the owner and I'll recommend running a CBC, which is basically a complete blood cell count, and it tells me what the red blood cells, white blood cells, and platelets look like and how many there are. If the platelets are low and they're newly anaplasma positive, that's when we recommend treating. We also treat if they're symptomatic, which can include a fever and lethargy. It's a pretty vague disease. They don't usually get super sick, although they can have some liver toxicity in rare cases, I think. But we're mostly concerned about the platelets in these dogs. So treatment for this one is a lot easier. It's only a 2-week course of antibiotics. It's the same one as doxycycline. It's also a bacteria that's injected by ticks. It's also one that they need to be attached for a day or two in order to transmit. So it is prevented by our same preventatives that treat Lyme.
Okay.
Or that prevent Lyme. Ehrlichia is the least common that we see. It's a little bit more common in the South and Midwest, I believe.
But more fun to say.
It is more fun
Come
to
on,
say.
Ehrlichia.
Yeah. If you can spell it, that's how you know you're good. So Ehrlichia is the least common up here, but it is the most severe. If a dog has Ehrlichia, most often they will show clinical signs, and if they do show clinical signs, they're pretty severe. So Ehrlichia is a disease that attacks the kidneys. This one definitely attacks the liver. Can I help you, sir? Hi. It attacks the kidneys. It attacks the liver. It can make your dog very, very sick. And this is, if they're sick, it's usually when they require hospitalization so that we can make sure that we're giving them fluids and flushing out all of the toxins while they're treating it. This disease is also treated with doxycycline. It's also preventable with the same stuff.
Okay.
So that's pretty much.
We've covered the ticks.
Diseases.
Okay. And Ehrlichia and anaplasmosis, curable or similar to Lyme in that treatable to a maintainable level?
Mostly the second one, treatable to a maintainable level. We'll still see them be anaplasma positive for years. We'll see them be Ehrlichia positive if they're positive at all. We really don't see it up here that often. We rarely treat anaplasma. It's a fairly benign infection. Sometimes we'll treat it if the owner wants to be on the safe side. Sometimes we'll treat it if they are showing a few signs and we can't really attribute to anything else.
Okay.
But yeah, they'll stay positive on that test for a few years. You can get reinfected with Lyme and we'll see basically a new infection despite the other one.
Okay.
So sometimes in some dogs we do see them test negative for Lyme in the future. future. So sometimes we'll see dogs that are Lyme positive, they're positive for like 2 years, and then they'll be negative for 2 or 3 years. They can continue to be negative, or sometimes we'll see them be positive again. If that happens, we'll retest, we'll do the C6, we'll run that whole gamut again, and we'll see, make sure that it's not an active infection, and then if it is, we treat. If it's not, we just let it go. So there's a lot of, it's a nice dichotomous key that we use for treating Lyme disease. It's a lot of if, then, because situations.
Okay.
But that's the basics of Lyme. It's not a deadly disease. It's not usually something we see kill animals. It just makes them uncomfortable, and it can make them very sick, but it doesn't usually, especially if you catch it early and you do your annual testing. Disease is so ubiquitous in our area specifically. This could be different for other areas of the country. Because Lyme disease is so ubiquitous here, the way that we try to prevent it is with a combination of tick prevention and the Lyme vaccine. And those have varying levels of efficacy of prevention because they're designed to do different things. So we have a lot of clients come in and like, oh, my dog already had Lyme, I don't need the prevention, I don't need the vaccine. Or, oh, I'm doing the prevention, therefore he doesn't need the vaccine, or vice versa. That's not really how it works. In an ideal world, we would have all of it because they do different things for the animal. So when we talk about prevention, it is a true prevention in this case. The way that preventatives work is if you're taking an oral prevention, there's two kinds, there's oral and topical. If you're taking an oral prevention, which is what most dogs have, then the medications are circulating through their system, and when a tick, in this case, bites the animal, it dies. And the idea is that it dies before it can transmit the disease, because I said earlier that it takes 1 to 2 days for the bacteria to fully transmit from the tick to the dog. The preventatives kill it before that 1 to 2 days is up.
Okay.
So we're not stopping them from biting, but we are stopping them from transmitting.
So if I've treated my dog and he comes in and he's got ticks on him, he's got an attached tick, do I remove the attached tick or do I let the medication do its job?
It's never going to hurt to remove the tick. It's just you need to make sure that you get the whole thing.
Okay. Best suggestion for removing the tick?
If you're good at it, you can use tweezers. Sometimes they make little tools. It basically looks like a teaspoon that somebody cut a notch out of, and you just literally scoop the tick off, and it takes the head and mouth parts with it, because the bacteria are in the mouth parts. So if you take a tick off and you leave the mouth parts, the disease can still transmit if they're attached to the dog. So you just need to make sure that you get all of it when you're taking a tick off.
Okay.
That's just the main thing. It doesn't really, I don't think I would successfully convince anybody to leave a tick on their dog for a few hours, for a few days. But so the prevention is killing the ticks before they can transmit the disease. That is probably more successful at preventing the disease transmission than the vaccine is. The vaccine is designed to initiate an immune response so that our body can recognize the Lyme when it gets into our bodies and fight it off. In an ideal world, it would fight it off completely. But what typically happens in the actual goal of the vaccine is to make it so that the disease is less severe when they get infected. So
Similar to our COVID.
yeah, similar
vaccines.
to COVID, similar to flu. There's other dog vaccines that are truly designed to prevent. Lyme is not necessarily one of them. We see dogs all the time that have the vaccine and they still get infected, which, for better or worse, which is another thing, like, it's not enough of a reason, in my opinion, to not do the Lyme vaccine, because Lyme disease can be very severe and you have no way of predicting how your dog is going to respond to the pathogen. But also, if you vaccinate your dog every year, at my clinic it's like a $57 vaccine. Doxycycline, depending on the size of the dog, could be upwards of 60 to 100. for a month. It depends.
Mm-hmm.
And it's an annual vaccine. You're paying $57 a year for this vaccine to prevent the disease from getting so severe. And also, if your dog gets Lyme and has been vaccinated every year for at least the past 2 to 3 years, depending on the company that provides your vaccines, they have a guarantee that they will pay for the diagnostics and treatment for the client.
Okay.
So it depends on your hospital. It depends on what company made that vaccine. But in my hospital, we have a good relationship with the manufacturers, and they do that guarantee with us. So
Okay.
if our clients vaccinate their animals for Lyme and still get Lyme, then they don't have to pay for treatment, which is at least some consolation for the vaccine not being able to prevent the disease.
Okay. Ear mites.
Ear mites are similar to fleas, except they're easier to get rid of. So the treatment for them is the same. Any flea tick prevention, any tick prevention will treat fleas. Some of them, if not most of them, also target ear mites, whether that's on label or off label, depends on the product. So on label basically means this was studied and approved under the FDA to effectively treat this thing. Versus off label is we see this work in practice, but the company hasn't invested money into proving it.
Okay.
Because that's expensive.
Okay.
So, Frontline will treat ear mites. NextGuard combo for cats will treat ear mites, I believe. So the way we treat those is with the monthly preventatives as well. Typically, what ear mites look like on a cat, you don't usually see the mites, but with your naked eye, I have not personally seen any ear mites, and I'd like to keep it that way. You can definitely see them on a slide. So what they look like is your cat will have really dark brown earwax, basically a lot of debris and buildup in there from their own production, because their ears are getting bothered by the mites. So they'll overproduce earwax, and then it'll mix with the wastes of the mice themselves, and it looks dark brown. It looks the same as a yeast infection of the ears or a bacterial infection of the ears. It's just dark brown means that there's something going on. So we can run a slide. Typically what I'll do if I see a cat with itchy ears, I'll take a swab very carefully. I'll take a swab of what's in their ears. I'll put it on a slide and I'll look at it under the microscope. If I don't see yeast or bacteria, it's kind of like a diagnosis of exclusion, basically. Like, I'll just say, all right, well, let's try this. And it's usually a preventative. I'll say, let's try this and see if it helps. We'll do this for like 3 months. And then if it works and the infection goes away, then I want you to keep them on it, because it means that they had something that they could get back if you take them off of this preventative. So it's kind of like a trial and error thing. I know how to test for a yeast infection and a bacterial infection of the ear. I can test for parasites and see them, but it's a little harder to find because they don't need to be as many to still cause problems. So if I don't see a yeast infection to treat, I'll try them, and they're not on prevention, I'll just try prevention and see if it helps.
So now we are moving on to fleas.
Fleas are gross.
Fleas are gross.
So the main thing about fleas is once you have them, you'll pretty much never get rid of them unless you throw out every soft surface in your house and start over.
Thanks.
You're welcome. So we talked earlier about the cyst stage of Giardia and how the whipworm eggs are so well encapsulated that they're really hardy in the environment. Fleas have a similar life cycle stage called the pupa, where they will literally go in, it's kind of like a flea cocoon, and they'll go into this little cocoon and they'll just nestle themselves into like carpet fibers and couches and stuff. Bedding is another one. And they'll just stay there until the environment is favorable to fleas. So the pupa have this weird ability to, despite the fact that they're in like a semi-hibernation state, they can sense CO2 levels and water levels, like the humidity in the air. And when those are high enough, suggesting that there's animals nearby, because they can sense the humidity because of panting and breathing, and the CO2 also because of breathing. So they can sense that an animal is there, they'll come out of that pupa stage and into the fully grown flea stage, and that's when it can infect the other animals again.
So basically what I need to do is to keep the cats from breathing.
Yep. So there's a lot of things we can do. I mean, I think everybody knows what fleas are. They come from the environment. They're transmitted by rodents and stuff. It's how the plague happens. But
I'm feeling so much more cozy. And itchy.
my bedside manner is flawless today. Yeah, so animals get fleas from other mammals, like rodents, other dogs and cats and stuff like that. They're not super species specific. The most common flea that we see on cats is the dog flea. The most common flea we see on dogs is the cat flea. So they kind of like play jump around.
Birds carry them too.
Yep. So anything can have fleas. The best way to treat for fleas is with a preventative, topical or oral. Most of the cat ones we have are topical. It's like a little mini syringe of fluid that you put between their shoulder blades or on the back of their neck, so that ideally they can't lick it. And that works really, really well to basically either kill the fleas or force them to jump off. And if the fleas aren't on an animal, then they'll die because they need the animal to survive.
Is that a monthly
Yes.
treatment?
Yep, preventatives are monthly, and especially with fleas, we want to keep them on that, ideally for life, but definitely for a few months, because we want to make sure that we're getting through that life stage. So basically, it's not necessarily that once you've got fleas in your house, you have fleas in your house forever. In a way, that's true, but there are ways that we have to manipulate their life cycle and manipulate their ability to detect CO2 and water and trick them out to coming out of that life cycle, and then they'll die again. So basically, if you find out you have fleas, treat all of your animals and keep them treated, wash everything in really hot water, use fairly aggressive cleaners, but make sure that they're rinsed off so your animals don't come in contact with them. Scrub down all your surfaces, keep your house clean, stuff like that, clean the bedding, and keep your animals treated, and then do that the next month, and clean everything again the next month. Keep your animals treated and clean it again the next month. They have a very specific life cycle, and as long as there's still animals in there, hopefully the idea is that if you retreat the house every month or so, every few weeks, those pupa are coming out of that stage and you can kill the adult flea. Those are very easy to kill. And then the next ones and the next ones. And ideally you would kill the fleas before they can lay eggs, and those can pupate. So you're kind of shortening or decreasing the population every month. So it's a long process, and it's very hard to prove that you've got fleas out of your house, but if you clean properly, or if you just make sure you're cleaning everything thoroughly every few weeks, keeping your pets prevented until you can replace the carpets or whatever, like, there's ways that we can manipulate their life cycle against them. That's typically what we'll recommend.
Okay. So if you've had a flea infestation, like we have, you know, again, as for those of you that have followed, know that Cheyenne and Sierra, no, I don't know why I keep wanting to call her Sierra. Cheyenne and Laramie came in infested with fleas. So if we treat those animals every month, we should be able to control the population of the fleas in the room. I haven't seen a flea.
Yes.
We were bathing animals every day,
Yes.
and treating the mothers as well as treating the rest of the crew, and keeping them in a bathroom where there wasn't the carpet to come down into. But we should be able to keep them treated long enough to get them into somebody else's house.
Pretty much. Pretty much. So here's the thing. So the adult fleas are going to die as soon as you treat them. As soon as you treat the animal, the adult fleas are going to die. Effectively. So what we're really doing by keeping them treated and cleaning everything every few weeks is we're trying to encourage those pupated larvae to come out of that stage and into the adult stage, because that's the easiest one to kill.
So what we're trying to do is reduce the breeders over
Yes,
time.
Exactly.
Okay.
So we're trying to trick the babies into coming into adulthood, kill the adults before they can lay more eggs. And
Okay.
so with each sequential treatment, you're reducing the population of pupated larvae in the environment, because they're
Okay.
not going to be on the animal. The pupa don't live on the animal. They live on the environment and then open up, and then the fleas jump onto the animal.
Okay.
So it's a long process, but it's not an impossible one.
So if you're just to reiterate for my own information, I guess, the process of bathing the kitten every day, because we bathe those kittens every day, in Dawn, and progressively saw lots and lots of fleas, and then we worked to no fleas. That wasn't killing the situation on the it was killing the adult animals, but it wasn't actually killing the situation, because the situation isn't the larva or the egg doesn't live on the animal, it lives in the environment. Am I correct on that?
Yeah.
Okay.
So you were making the animal's life better by getting the parasite off of them, because fleas are blood-sucking parasites. You're still making your pet's life better by getting the fleas off. But like I said, and like Debbie just reiterated, the continual treatment is not necessarily for the adults. It's to trick the pupa into coming out, and then we can kill them as adults.
Young adults, before they get breeding.
Yes. Before they lay more eggs.
Oh boy, well, I'll just be vigilant.
Stay vigilant.
Stay vigilant. Now I'm itching.
Yeah, and we do have, some clinics will have products available. It's basically like a flea spray. It's for the environment, do not put it on your animals. But some clinics do have a very strong chemical mixture that is designed to kill fleas. I know our hospital uses it. We spray down the entire room after a flea appointment because it's gross.
Mm-hmm.
And we're not about to infect our other patients. But you can talk to your veterinarians about products like that and how to use them and how to make sure that they're cleaned out of the environment before you put your pets back into it so they don't ingest chemicals. But there are products available designed to kill fleas in the environment, and trust me when I say science is trying to target the pupa as much as possible.
Yeah, because they're not fun.
No, they're gross.
They're not fun. And they are dangerous to the kitten,
Yeah.
or to the puppy. They are dangerous too.
Yeah, this is one that can kill an animal if they drink enough, if they suck enough of the blood, because without blood you don't have nutrients and you're going to be very anemic, and that can be life-threatening, although it takes a very high flea burden.
Okay. So if that cat is being treated, I think I could be the only one. But I think that a lot of times we don't do monthly preventions on our indoor cats. And again, I'm learning as we're going along here too, talking to Dr. Delaney. I think that I'm in a category that is unique from a lot of pet owners, in that I have a constant flow of new animals coming into the home. And oftentimes, well, more often than not, they have one of these parasites that we've talked about in their systems. It's very rare that I have an animal that is clean, and usually I have an animal that's clean from all parasites because they've been in the foster system in their point of origin where they've been treated and come here. So most often they come in with something. So should my cats all be on a monthly treatment?
The answer to that is always yes for me, and I'll just give you the spiel that I tend to try and give most of my clients. We can talk about it based on everything that's being prevented. So if you're doing a combination prevention, which is what I always recommend first, so that's a prevention that does ectoparasites, so fleas, ticks, ear mites, as well as the internal parasites, so your heartworms, your tapeworms, your roundworms, stuff like that. That's my top of the line gold standard. And the reason I suggest those for indoor kitties is because even if the cat doesn't go outside, the bugs can come inside. How many times have we seen mosquitoes in our houses or flies in our house? Like, how did it get in and had everything closed? They find a way. So, ticks, it's a little less common to see ticks on an indoor cat. So, that's neither here nor there. It's just a benefit of giving them the prevention. As far as fleas go, we've already talked about how hardy they are in the environment. They can be in your yard from the rodents. I'll have a lot of clients who say, no, they're indoor only, and then we'll be talking, like, oh, she loves her catio. Well, a catio is outside by definition, and it's a screened-in catio. Okay, well, a mosquito can come into the screen. Like, that means that they're not truly an indoor cat. I'm sorry to say it, but a catio is not indoors.
And I think that a lot of times the misperception that's there is, well, my cats are indoor cats. My dogs go outside all the time.
Yep, that's the other
So
thing.
the dog, I've had more instances. I work with children as an occupational therapist. Children would get tick bites because they'd been cuddling with the dog, and the dog brought the tick into the house.
Yep, that's another thing that we talk about with our clients. Is your cat the only cat? Oh, well, no, we have a dog. Well, does your dog go outside? Yeah, we go on walks every single day. He loves the woods. Okay, well, then your dog can bring a tick or a flea into your cat, and your cat can get it that way.
Or birds as well.
Mhm.
We've talked about birds and the fact that they can have fleas. So if you have birds, I promise you, you're gonna have mice somewhere around you too because of the amount of grain that comes through the house. And the things that are in grains when they come into your house. And so I think, if you have cross species, if you have cats, dogs, birds, humans, we can all bring that stuff in to our sweet, loving indoor kitty that never goes outside.
Absolutely. Even opening the window can put your kitty at risk. So there's those things. There's mice get everywhere. Mice will come into your house, things like that. If your cat is a good mouser in the house, you should have them on prevention. For all of these same reasons. Also, if you just moved into a new place, you don't know what was in there before, especially if it's a rental. If that rental has carpet or something like that, you don't know what's in there. Please clean your rentals before you move into them. So it's always a good idea to keep the prevention, and we've only talked about the ectoparasites. As far as the internal parasites, if you prevent fleas, then you prevent tapes. There's a 2-for-1 for you. If you prevent fleas, you prevent ticks, another 2-for-1. If you are most heartworm prevention will also treat for roundworms and hookworms at the very least. Not always whipworms, but that's not a cat thing anyway. But if a mouse gets into the house and your cat eats the mouse, if a bird gets in the house and your cat eats the mouse, if they're on a catio, then they can get exposed to these things. Or even if you have the perfect setup, you never open the windows, you have air purifiers, you have bug traps, whatever, your cat could escape. And that's not something you can control, especially with the Houdini kitties. So it's always a good idea, especially if you know you're going to get it back, that you have it on prevention, because if your cat gets out, you want them to be safe and healthy and protected when they come back.
Well, and funny story, not so funny story, but funny story now that I can look back on it. When I was in college, I had a Cocker Spaniel that lived with my parents. And if you've ever met my mother is very clean. So there were not going to be issues. The animal was treated regularly. So Cinnamon was in great shape, no fleas, no ticks, no issues. I was in college. I had a cockatiel actually at the time, but she is doesn't matter. I lived with a roommate. One of the bigger regrets of my life. I lived with a roommate that was largely um, into the great outdoors and cowboys and the cowboy life. And so she would um, go out and rope cattle and work with cattle and do that kind of thing. And she was not the cleanest of individuals. And so she, ultimately, what happened was that Rudy brought fleas into my house or in my apartment. I took fleas home to the dog. The dog got fleas from me because I had brought them in from her working with cattle and cattle dogs and just being out um, doing cowboy things.
Yes. Anything can happen, and it's impossible. It's nearly impossible to create a true bubble. So when I'm talking to my clients about these things, um, that's typically the avenues that we'll take. And I'll usually try to tailor it to figuring out what their concerns are. Some people are worried about the medications affecting their animals because these are technically poisons. If you take too much, it'll kill you. But we're taking it at such a low dose, it's like chocolate. That's usually how I'll describe it to people. We can eat chocolate, but dogs can't. It's because dogs are smaller and their metabolisms are different. So yes, I am giving your pet a poison, but it's not their poison. It's the pest's poison, because they're different animals.
So you're giving it at a level that is dangerous to the pest, not to the pet.
Correct. I've had a dog personally eat, I think, 8 months of Heartgard in one go. He was fine.
Was that Jake?
It was Sherlock.
Yeah. It's fine.
40-pound beagle nightmare, and he ate them all, and he was fine. Like, they're safe for dogs, and they work really well against these bugs and cats.
Cat, the cinnamon, the cocker spaniel I was talking about, ate a bag of dark chocolate chips. It wasn't pretty in the house for a while, but she survived it.
I have a dog that gave himself salmonella from eating raw chicken. Cured it. Smell it. Cured it.
Sometimes they're not their best advocates.
Yeah, you can't predict what your animals are doing. You can not predict what the outside world is going to do, what your guests are going to do, and things like that. So it's always easiest for your own peace of mind and your animal's health to utilize these preventative measures to ensure that you're protected and your house is protected. And if we ever do a heartworm segment, that becomes true tenfold, 10 times over. Heartworm is a big one.
Yeah, so we've covered all of the worms, or at least the major worms, but we didn't cover heartworm. And the reason we didn't cover heartworm is that Dr. Delaney and I discussed that we're going to just do a whole segment on heartworm. I think it's one that we don't see a lot up here in the north. However, we have a lot more animals coming from the south up to the north, and so the people that are taking the animals up here are the ones that are actually dealing with the heartworm that started there. Both Delaney and I have animals that have had to go through the heartworm treatment, and it's not pretty. Coda had to go through the heartworm treatment. You've met Coda before, and her dog Jake that you see in the picture of her with her black and white dog has gone through the heartworm protocol as well, and he came from the south. So it's very easy for us to say, oh, that's a south issue. No, it's a north issue because we're the ones up here trying to take care of it.
Yeah.
So we have one more, I believe, and that would be ringworm.
It's a doozy. So like I said before, ringworm is not technically a worm. It is not a mite or a parasite or a bug. It is a fungus, which is gross. Ringworm is fairly involved. It is transmissible from pet to person, so and it's not always going to show signs.
And from person to pet.
And from person to pet. Dogs typically show signs more than cats do. Cats can sometimes fight it off themselves, and you'll never know that they had it until you have it. And or they can show lesions. So typically what you'll see is those like patchy hair loss areas. Their coat might get a little dry. You might see some nodules on dogs. Dogs tend to react a little bit more to ringworm than cats do. The way we diagnose it, we have multiple tests. The simplest of them is what we call Wood's lamp. Basically, you shine a black light on it, and certain species of ringworm will luminesce and they'll turn green. That is not a definitive treatment. You can still have ringworm and not luminesce because it could be a different species, or it could just not be a large enough population that you can see it with the naked eye. So if you have a cat...
Can you luminesce and not have ringworm?
No.
No. Okay.
Uh,
Unless you put glitter on your bed.
Yes. So there are certain things that will bioluminesce, or not bioluminesce, that will look green. But usually you can rule those things out by having, like, have you bathe the animal? Like, do you put stuff like creams on the animal? Creams can look like if you condition your cat's coat for some reason. There are things that can light up under a black light, but usually if there's no rash and it luminesces, we'll ask you, like, do you use any product? Like, what is your cat's routine? And we'll rule it out that way. But if they have the clinical signs and luminesce, we can pretty much guarantee.
So the clinical signs are the lesions or the hair loss spots or the nodules that you're talking about. Mm-hmm. So you're not checking a dog for ringworm. It's come in with this issue.
Yes.
And now we're trying to figure it out.
Using a Wood's lamp is not part of our typical physical exam.
Okay.
We only run those tests if we have a suspicion of ringworm. So if this animal came from a hoarding situation, if it came from a house that we know had ringworm, or if the client specifically asks for it, we'll run the test. So that's the easiest one to do. It's not the most accurate test. Like I said, different species of ringworm can cause the same problems, but not luminesce the same way. So the other tests that we run are fungal cultures, mainly. We can also run PCRs. So basically what we'll do is we'll pluck hair from around the site off of the animal, and we'll put some of it into a petri dish, put some of it into a test tube, and we'll send some of it off just like as is to the lab. So the culture will grow fungus, and then we'll run a PCR on, and it's looking for the specific fungal bacteria and multiplies, and we can detect that. The good thing about those tests, especially the PCR, is that it's extremely accurate, and you can get a definitive result on a small sample. That's the nice thing about PCR assays.
So what are there symptoms? What is happening to the animal that has ringworm besides the hair loss areas?
They're itchy. Usually it's just hair loss and they're itchy. You might see like little pustules, which is basically tiny infected pockets of skin, or like scaling and flaking. But that's the main two, is hair loss, like scaly, patchy hair loss, and itchiness is typically what we'll see. Also, cultures take like weeks. Fungal cultures do not grow quickly. A bacterial culture can take maybe a week to run and get a result. Fungal cultures, we're talking weeks to get a result. So we typically recommend running all of them at once, but a PCR is what's going to give us the most accurate information quickly.
Okay.
As far as treatment goes, we're kind of coming away from the world of topical treatments. So like your lime sulfur dips, they're smelly. It's hard to give a cat a dip. They don't like it. Their fur gets really crunchy and gross and oily and sticky. They still work, and we're not going to tell you not to do it. But if we don't have to, we won't, because that means if we also have to touch it, and it's just gross.
It is all about you.
We try. There's also like Chlorhex solutions, which is that blue, green, or pink stuff that veterinarians scrub sites with. You can clean wounds with it, and it doesn't irritate the skin. Ringworm is usually self-limiting. However, we usually end up treating it anyway because it's gross and it's zoonotic or it's transmissible to people. So we're usually not going to just let it run its course. Usually we're going to do something about it. The only times we ever wouldn't treat is if we didn't know it was there. If the animal didn't show signs and just got rid of it itself. That usually is a cat thing, not a dog thing.
Okay.
As far as treatment, we use oral antifungals. Depending on what medication you use, changes the dose and the frequency, but it's usually a 3-week course. So for dogs, we'll run an oral antifungal for 3 weeks.
Okay.
For cats, we'll do it on and off for 3 cycles. So you'll treat for a week, 1 week off. Treat for a week, 1 week off, and then treat for a week. And at the end of that treatment cycle, we'll rerun our tests. Ringworm can be cured. It does have a cure, and it is these antifungals. The best way to know that you have a cure is to rerun your PCR and your culture, and both of those should come back negative.
What about handling the animal in the treatment period?
Wear gloves.
All through the treatment period.
I would. The medications themselves shouldn't hurt you, and if you have an animal diagnosed with ringworm, it's always a good idea to consult your own doctor to make sure that you're protecting yourself and anybody else in your house appropriately. All we can do as veterinarians is tell you yes or no, this is zoonotic. We cannot tell you how to fix it. We can tell you how to fix your environment. We can't tell you how to fix you.
And we need to isolate the animal as well, correct?
Yes. If you have other animals in the house, isolate it. If you have children in the house, try to keep them from touching the animal because kids are gross and they will touch their faces and other children, and it's just going to be a mess.
Children are spreaders.
They are spreaders. That's a good word for them. Yeah, isolate the animal, wear gloves when you're handling them, clean everything. It's not going to be a fun 3 to 6 weeks, but I promise you it's going to be a lot less miserable if you can get it done right the first time and not give yourself ringworm and make sure that they don't have it again at all. So
I had an entire litter of kittens come in with ringworm. Because kittens can be gross too.
Anything baby is pretty gross.
Yeah.
Yeah, so clean your environment. We're gonna clean the environment. We're gonna make sure that we're using the appropriate cleaners, hot water, all that thing, and we're gonna continue treatment until they're cured, until the PCR or culture comes back negative, basically.
So those are the ickies that tend to be the parasites, the fungus, that we tend to see here. I grew up in Colorado. We dealt with lice as well. But I have not had any of the animals that I've had come in here have lice, so it must not be it. Just those gross kids.
It exists. I don't think it's as common up here, but lice is very species specific.
Mm-hmm.
So if your dog has lice, you're not gonna get lice.
Okay. I grew up with horses, so I think we saw a lot of lice because it can be pretty prevalent on horses. Anything else? We've covered the ickies.
Yep.
Good, the bad, and the ugly. Yep. All right. So, again, we did not cover heartworm on this one, although it is definitely a worm, and it is the most dangerous of the worms, I would say, unless you're dealing with puppies, and bad infestation. So we're going to cover that again. We have a lot of segments that both Delaney and I are thinking through on lining up, and if you have something that you'd like to hear from the vet, just comment below. Make sure that you like the segment, like the channel, and subscribe to the channel. Certainly we try to cover a broad spectrum of things, both cats, dogs, veterinary care, training care, just basic breed care. I have a segment coming up that we're going to call Who's Your Daddy, where we talk about genetics and reproduction. So it would really help us if you become subscribers of the channel. We are very close to being monetized. I think we're at 940 followers right now. We have to get to 1,000. And we need to get to 4,000 viewing hours, and I think we're about 300 shy. So if we can get those up to where we're monetized, then we can start funding the Cuddles Co-op to help adult cats that are harder to adopt get in with our senior citizens who need some companionship. So if you can do that for me, I would appreciate it. We may be hearing from Delaney very quickly because we will be getting the 2 puppies coming in on Saturday with the double Merle, correct? Double Merle genetic issue. So we may have her talk a little bit about that too when we have the puppies here, and you can see the puppies in action. So for now, thanks for joining us on A Soft Pause. Thank you very much for joining us again, Dr. Delaney, and we will see you soon. Thank you very much.